All right, we make the transition from one medical story to another. Thursdays, we always have folks come in from the medical community to talk about things today. Today we have Dr. Meena Rao from New Hanover Regional Medical Center, a cardiologist there, talking about the #1 killer of women, which is?
Cardiovascular disease. So this month is Heart Month, and we're taking this opportunity to try and educate women about cardiovascular disease.
Yeah, I was going to say, education seems to be the thing this morning that you really wanted to stress, because while most people know that this is the #1 killer, a lot of women don't think it's going to pertain to them.
Right, so in 2003, the American Heart Association did this survey of women, and 50% of women understood that cardiovascular disease was the #1 killer, which is different from before. It used to be we talked about breast cancer, about other things. So it's a great number. There's certainly room for improvement, but only 13% of those women thought that that was a personal health risk for them.
Are the reasons behind that? Do they just think that, is it, well, this can't happen to me? Was there no family history of this?
Well, I think part of it is that women tend to present differently with heart disease. So the symptoms that we think about in like movies where you see somebody clutching the left side of their chest with chest pain, those things, women do present with that, but they tend to describe it differently. And then they have symptoms that are confusing. So whether they're short of breath, they're sweating, or have shoulder pain. So it tends to kind of confuse the picture a little bit, which is why it's important that women understand kind of what the symptoms may be of heart disease.
It's interesting to me because typically you hear men are the ones that, I'll get it checked out tomorrow, I'll get it checked out the day after tomorrow, and with women not thinking that this would affect them. You mentioned the symptoms maybe for women a little bit different. What are the differentiations that you might feel that I wouldn't?
Well, I think it's just being aware that women don't typically have that chest pain, and that they have different symptoms, and that being aware of those other symptoms and feeling empowered to call 911. So there's this educational website called The Heart Truth that's got a lot of great information about cardiovascular disease for women. And one of the most interesting statistics on that website that I saw was that 50% of women, when they thought they were having symptoms of a heart attack, would call 911. That means 50% of women would not do that. They would call their friend to come into the hospital or take them to the ER or call the doctor on call. And when you're talking about a heart attack, time's essential. So I think taking this month and participating in some of the educational activities and understanding what the symptoms can be and feeling empowered to call 911 is really important.
Yeah, and the good thing so far since we've been doing these medical segments is 0% of the population has called me to ask me anything. And I always say, do not call me. You always call 911 if you think you have a question. And if you just have a general question, always contact your doctor because she has an education I can't have. We're back with more after this.